Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about what happens when you want to do palatal expansion, be it an RPE, RME, whatever you want to call it, with Schwartz, and you're worried because the patient has a really steep mandibular plane angle, maybe with antegonial notching, all signs of the backwards growing instead of the forwards growing. A long dolichocephalic face, not a brachycephalic face. Nothing wrong with that. Often these are related to airway issues, these type of growth issues. But if it's in someone that's either almost done growing or it's a kid, you're looking at this case and you're like, okay, I definitely need to expand. I have a very narrow maxilla. The bite isn't integrated, I have a vaulted maxilla. It's going to help the airway, et cetera, et cetera. But when you expand a patient like this, it's going to actually make them steeper. So that's something you keep in mind. Just like when we have a flat mandibular plane angle and a deep bite and our forward grow, we might put anterior bite turbos on the case, anterior bite plate on the case, fixed bite plate on the case. Opposite is true when you have a long dolichocephalic face, antegonial notching, and a steep mandibular plane angle. And this is why you got to take steps. I mean, obviously, I'm looking at the face. I'm looking at the profile picture. I'm looking at the length of this face. I'm looking at those thirds. You remember those thirds? Third. You want your thirds to be even. So all kind of things to think about, right? So one of the tricks you can do is you can build some type of intrusive force into your appliance design. So if you make the back thicker, okay, whether you use articulating paper and put like bite bumps on every posterior spot, you could do that. You can kind of create your own bite ramp. You can build it into your appliance and cement it. I mean, this is very effective. It's just kind of a hygiene and odor and smell nightmare. It's gross. And there's always a risk you're going to get a lot of decay. I've seen these teeth get crazy bombed out if they have like a habit of like juice and sodas and energy drinks. You can end up with just crazy decay. You're going to end up losing teeth. So you really have to pick your patients wisely. You have to keep them on a really short hygiene leash. Whether you're going to be building in virtual check-ins for hygiene and things like that, whether you're going to have them come into the office more often. So however you want to design this appliance, you can, but you just need to make sure that there is extra intrusive forces on the appliance, because an expander in its nature has extrusive forces, right? Now, on the flip side, you could, let's say it was kind of an adult, definitely wasn't growing, and so you knew you were not going to get skeletal expansion. So you don't really need this kind of expander. You just want to get arch expansion. Then it might be better to do Invisalign, because clear aligners have natural intrusive forces that can be built into them. You can ask them with the attachment to intrude the molars while you're expanding the arches. That's something that you can't do with braces. I mean, you could put TADs on it and do all kind of stuff, but that's not something that I teach. And I've gone over the whole TAD thing, what it's like to be a parent with a child that has TADs, and it's not something that I choose to use in my practice. I don't do it anymore. Let's put it that way. There are plenty of doctors who are good and proficient at it, and that's the type of ortho they want to do, be my guest. That's not the type of ortho I like to do. So if it's a surgical case, I'm going to go ahead and refer that out. I teach the non-surgical cases. And that's what I teach as well in my consulting practice. I really don't think that general dentists should be doing surgical ortho cases. I think that's the limit. That needs to be going to orthodontist. Not to mention it adds to the expense, the discomfort, the whole interdisciplinary nature of things, and really weird things can happen. So you need to be prepared. I think if you're going to do any type of like TADs and things don't go right, you need to be prepared to pivot to jaw surgery. So unless you're capable of handling that kind of case, I don't think you should be dealing with TADs, but that's just my personal opinion. All right, so thanks so much. Just something to keep in mind whenever you have an expansion case. Look at the length of the face, look at the mandibular plane angle, and look at the antegonial notching. All right, thanks.